Hi, I'm Kevin Ashworth, the Clinical Director at Northwest Anxiety Institute. I'm also one of the supervising clinicians for our practicum and internship students. We're really excited to have a training institute at Northwest Anxiety Institute where we focus on delivering cognitive behavioral therapy for anxiety disorders. We treat all the anxiety disorders, obsessive-compulsive disorder, panic disorder, social anxiety disorder, and really any of the diagnoses that respond well to evidence-based treatment, specifically behavioral interventions or cognitive behavioral interventions. We do a particular intervention in cognitive behavioral therapy called exposure response prevention, which happens to be the gold standard treatment for anxiety disorders. A student that is a good fit for us at Northwest Anxiety Institute is somebody that is interested in gaining a lot of experience in how to be a cognitive behavioral therapist, and of course particularly someone that's interested in treating anxiety disorders. I tell folks anxiety is the #1 reason people seek mental health services, so it's a very marketable skill to have some experience how to do these interventions and understand the theory of CBT. On average, at least this year, we have taken about 10 students, and so that's what we're looking for. And when students are participating in our internship, they will receive both individual and group supervision each week, so you get an hour of each. In addition to that, we provide an hour of didactic training, which is lecture-based training for just ongoing learning. There is so much information to learn out there, and we want to kind of give that to you throughout the year. And then lastly, we invite our students to join our clinical meetings, what we call our roundings, at least once a week. And I tell students these are really helpful because it's an opportunity to see seasoned and licensed clinicians actually be vulnerable. It's where you get to see very skilled and licensed clinicians talk about the things that they don't know, or perhaps missteps they may have had, or just confusion or questions they have in the clinical setting, which I think is a really nice experience for students. Students at Northwest Anxiety Institute will get to participate, of course, in outpatient therapy. So that's a bulk of what we do, is doing that 53-minute kind of traditional therapy. We also offer lots of outpatient groups. And so students get the experience in co-facilitating and perhaps even eventually facilitating groups that we run or that groups that you're interested in as a student yourself. What's unique about Northwest Anxiety is we have an intensive outpatient program. Our intensive outpatient program is where clients attend therapy 3 to 5 hours a day, nearly 5 days a week. For weeks and weeks on end. And so it's an opportunity to work with folks in an outpatient setting that may be a little bit more acute in their presentation and need more services. It's also a really cool experience to see pretty quick change in clients that you work with and work alongside some of our licensed staff. The expectations for students at Northwest Anxiety Institute is roughly about 20 hours a week. 10 of those are client-facing hours or direct client hours. Therefore, students carry a caseload of 8 to 10 and then help participate or co-facilitate in other experiences with other students. So I would imagine most folks are here about 2.5 days a week for their practicum or internship experiences. And right now, one of those is in person, where you can see clients at the office, and the other day and a half is completed virtually from a HIPAA compliance setting, wherever that might be. One thing I didn't mention is that we do provide all incoming students with about a 2-week of an intensive or robust, I would say, training opportunity. Both it's an onboarding experience where you're getting all the administrative onboarding tasks, but lots of training where you will learn a lot more about anxiety disorders, cognitive behavioral therapy, to really prepare one to start seeing clients at our site. We realize that many students coming to our site have not had a lot of experience with cognitive behavioral therapy, and some haven't actually done therapy yet with a client. And we are okay with that, we understand that, and we expect that. Our expectation is that by the end of the 12-month practicum experience, students feel competent and confident in their skills as a clinician to kind of deliver cognitive behavioral therapy.
My name is Anna, and I am a fourth year doctoral student, and I was a practicum student last year for Northwest Anxiety. I think the community here has been fantastic. Watching my clients grow throughout the year and the change that they went through, it was amazing. Learning exposure response prevention as a clinician was a really awesome experience because it works. I really got to see how well ERP can work for a client, moving from a place of fear to a place of bravery and confidence. With the Northwest Anxiety internship, you can expect to see a lot of different things. You can expect to see growth in yourself as a clinician, and you can expect to see, or you can witness the growth of your clients in really profound ways. If I could tell myself anything on day one of training for Northwest Anxiety, I would tell myself, you've got this, and also you're about to see some amazing growth and you're going to be inspired for the rest of your career.